Hi, everyone. I'm Carol Massar, anchor of Bloomberg Business Week on Bloomberg Radio and Bloomberg TV. I'm so pleased you could join us today at our Mental Health and the Economy virtual event. Now, we know that COVID-19 isn't just a deadly threat to human life. It's also a mental health crisis with economic consequences. Fear of illness, strict lockdowns, isolation from friends and family, rising unemployment, and collapsing businesses weigh on the hearts and minds of people all around the globe. That has led to poor mental health for so many of all ages and backgrounds, for so many of our working colleagues and family members. That poor mental health also has a societal and economic impact. In the next hour, we're going to examine what the public and private sector can do to safeguard people's mental health as the world continues to grapple with COVID-19. Now, before we get started, a few housekeeping announcements. First, I would like to acknowledge our sponsor, Cigna. Now, in terms of audio issues, if you have any problems or video quality problems, try to refresh your browser or use the chat box in the bottom right corner of your screen for support. You'll also be able to submit questions during the interviews. We do hope you'll engage with us. We'd love to hear from you. While we're probably not going to get to all of you, we will try to do our best. Now, to submit a question, click open the white tab on the right-hand side of the video window and submit your question. If you note your name and geographical location, we'll also give you a shout out. And please engage with us also on social media using hashtag #TheFutureOf and engage with other attendees in the event chat in the bottom right corner of your screen. All right, that's done. And now to get started, first, let's get a few words from our sponsor.
Thanks, Carol. And let me begin by welcoming you all to Bloomberg's Mental Health and the Economy webinar today. I'm very pleased to say we've got a great lineup of speakers on what is a really important sort of topic. So let me begin by thanking our speakers today. First of all, thanks to Jimmy Etheridge, who's the CEO of North America for Accenture. Also thanks to Lena Nair, who's the Chief Human Resources Officer at Unilever. Dr. Ashwini Zanus, Chief Medical Officer for Salesforce, and Professor Richard Bentel, who's the Professor of Clinical Psychology from the University of Sheffield. Also, thanks to our moderators, and of course, special thanks to our host, Carol, all of whom have given their time very generously today. I think we'll all agree that COVID-19 has impacted us all in a range of different ways, but particularly it's had a significant impact in terms of people's health and well-being. And the reality is never has health and well-being been more top of mind for both employers and employees than it actually is today. And I think what the last 12 months has really taught us has been the importance of both agility and resilience as we've all navigated through these very challenging times. And as we actually look to the future, I think we'll all agree that probably the pandemic has actually resulted in some fundamental sort of long-term changes in the way we work, rest, and play. And it's for that reason, it's never been more important that we appropriately equip our employees in order that they can cope not only with the new ways of working, but for many, the new ways of living. At Cigna, we've seen the mental health issue sort of growing for a number of years now through the various sort of global surveys that we've been doing. But I think an unfortunate impact of the pandemic is the fact that we've seen an explosion in mental health challenges around the world. And we've actually seen people facing sort of mental health issues that we would never have thought of previously. Particularly the young single employees that have had to endure, a series of lockdowns and have been faced with the issue of loneliness and isolation that they would never have had to experience before. Here at Cigna, we're truly committed to working with our customers, clients, our business partners to help everybody around the world address this really important issue. All organizations, no matter how large or small, have a role to play in helping provide appropriate support to address mental health. Here at Cigna, I'm pleased to say that we've actually developed a range of tools that employers can use and adapt to provide support to their employees. Our Cigna Body and Mind app is just one example, and that can easily be downloaded from the App Store. We've also got a range of reports and surveys that we've done throughout the sort of pandemic. And again, I'd encourage you all to take a look at those because there's some really valuable insights in those. 14 months into the pandemic, as we look to the future, there perhaps is some light at the end of the tunnel and some positive signs emerging as we see sort of vaccines being rolled out in many markets now, and them having a sort of positive impact in terms of slowing down the spread of COVID-19. But the reality is, though, still individuals' health and well-being will continue to be top of mind for us all, and hence why this webinar is so important today. So let me conclude again by saying a big thank you to all of our speakers, particular thank you to Bloomberg as well for hosting this very important event. Last but not least, thanks to all of you for taking the time to listen and learn today. So with that, let me hand back to our host, Carol.
Hi again, everyone. If you're just joining us, I'm Carol Massar of Bloomberg Businessweek TV and Radio. The World Happiness Report came out just a couple of days ago. It was a long report. And on the positive side, the pandemic has exposed mental health as never before, with increased public awareness, including by our employers. On the flip side, there is no doubt that the initial effects of the COVID-19 pandemic on mental ill health symptoms were large, negative, and remarkably consistent, worst in younger age group and women, ethnic minorities, and those with pre-existing mental health problems. And we really don't know the long-term impact on individuals' mental well-being, nor that impact on their physical health, on their ability to contribute to society and really be part of our economy. So still, so many questions out there. Playing a vital role, though, in helping individuals find their way back and improve their mental health are leaders like the one that is joining me right now. I am so delighted to have here Jimmy Etheridge. He's the CEO of Accenture North America. And Jimmy, it's great to be with you. And I want to ask, we have a lot to talk about, but first up, leaders like you, we really rely on to kind of get some indication of where we are in this pandemic, what's coming up post-pandemic, because I feel like part of the stress that is on all of us right now is that inability to kind of see what's next, a lack of visibility.
Right. Well, Carol, thanks. I really appreciate this opportunity to talk to you today, to talk about the subject. And frankly, it's refreshing to have an interview right now that starts with a happiness survey. You know, we survey the C-suites of our clients a couple times a year. And the outlook right now is as optimistic as it's been. If I look back to the fall when we did our one survey, I think things were really kind of trending pretty pessimistically. But the survey that we did in December, which is over 1,500 C-suite executives, the vast majority are anticipating this K-shaped recovery, consistent really around the globe, and a pretty optimistic outlook. A little more optimistic in North America, where about half of these executives feel they'll meet their growth goals by the end of 2021. A little more pessimistic when you look at Europe. And, you know, I think not surprisingly, a lot of this is tied to success with the vaccine and vaccine deployment. But I think what I have certainly seen is what's happened with COVID has really created a little bit of a technology time machine, and clients are moving much more quickly around technology investments, looking to achieve in 10 months what normally would have taken them 5+ years to do. And that's good news for our business because we're exactly where our clients need us to be. But as you were saying with some of the survey results, the fact is a lot of the productivity that the clients have experienced over the past year has really been through adrenaline as much as anything. And you can't sprint a marathon forever. And I think the pressures on people are continuing to increase.
Well, let's talk about those pressures. I've seen them firsthand. I've seen them with colleagues. I've seen them with family members. Jimmy, what have you seen with your employee base, with your leadership team over the past year?
Mm-hmm. Well, first of all, I'm really proud of what our employees have been able to accomplish. The creativity, the compassion, and the resiliency. We shifted what has been a long traditional client service model of being on site at clients with a lot of our services to completely working remotely, and for most of our employees, working from home. And the fact that we were able to do that without skipping a beat with the client service, the fact that we've had to shift so many key processes to being virtual, it still blows my mind that with the thousands of people that Accenture has hired in the last year, none of them have ever stepped foot in an Accenture office. Probably none of them have met in person with Accenture leadership or colleagues. But the compassion and grace that I've seen our people try to take care of each other in dealing with, what's a combination health crisis, economic crisis, and social crisis, it makes me very proud. However, while the teams have been incredible, they are clearly feeling the stress, anxiety, depression. Like a lot of corporations, we do internal surveys, and it was very clear that everyone is feeling that. And I think it kind of goes back to the point I made earlier that the adrenaline can only take you so far, and the things that are happening to people that they're having to deal with are really putting a lot of pressure on mental health.
Well, and what's interesting is I feel like we all will say, how you doing? I'm doing okay, or I'm having a bad day. And then we just kind of brush it off. But when you start to drill down, and we actually took a poll of our audience here and asked the question, have you experienced any of the following since COVID-19 lockdown? And almost 40% said they have experienced anxiety. Almost 31% said they felt lonely, 26% depression. And then in terms of thoughts of self-harm, about 4%. I think so much in terms of this discussion, it's important when we get specific about what you're feeling and how you're feeling. Tell me, like, those results, how do they speak to you?
I certainly can relate to them, and I can relate to them personally. I mean, my life is a lot different than it was before. I haven't been on a plane in over a year, and you're talking about someone who lives in airplanes and airports. My dogs have gotten to know me better than the guy that just treats us on the weekends. And of course, I've got the cliche COVID puppy that has become a key part of my stress therapy and kind of coping mechanisms. But I will say, back to your point about how are you doing, I'm speaking more frequently with the C-suites of our clients, in part because video just enables it a lot easier than getting on a plane and going to meet with someone. And even though that ordinarily wouldn't feel as intimate, it really has, because I think for a lot of the one-on-one discussions that I have, when it starts with that traditional check-in of how are you doing, we're really sharing how we're doing, how we're feeling, how our families are feeling. And so I think it does mean something. And I think that's really important for us to continue to do. And, the other points that you're bringing up, with some of those survey results, the idea of self-care, I think, is so important. And, I say a lot, it's okay to not be okay. A lot of the people that I speak with, and a lot of the people at Accenture, they pride themselves on trying to be low maintenance. They have a super strong work ethic. They care a lot, have a lot of pride about their craft and the impact that they're having. And the last thing they want to do is raise their hand and say, I'm struggling today. I'm really struggling to be at work. And I think we have to validate and acknowledge and provide support for people, make it okay to not be okay.
Right. I thought your LinkedIn post was really smart about it's okay to say you're not okay, and really be upfront about it. Having said that, there was an audience question that came in. This is Jason in the Philippines. He says, how can employers recognize mental health problems during the pandemic? Like, how do you know what's going on with your teams? How do your leaders know what's going on really with your teams beyond the Zoom screen?
Mm-hmm. A great question. And I've put my whole leadership team through a half-day mental health ally training that Accenture has. And I think that's been very helpful to give us more confidence at how we talk about issues like this. And like I said, as someone who's spent a lifetime as a problem solver, it's really helped me see that when I'm talking to someone about how they're feeling, I don't need to jump into problem solving mode. It's really about validating what they're going through. Mm-hmm. And without judgment, providing the support that they need. But I think that the onus is on employers to raise their game in terms of recognizing mental health issues and providing support for it. So, for example, here at Accenture, we have a couple things that we've implemented in the last year that I think have been very positive. We have a self-paced learning program. We call it Thriving Mind. And it really teaches us the science about stress and how to recharge the brain's batteries. We did this with Thrive Global and Stanford Medicine. And we've had over 160,000 Accenture employees complete that training. And the feedback once they go through that training is that they feel significantly better able to handle the challenges that they're dealing with. So doesn't mean those challenges have gone away, but it really helps. And I think, again, the Mental Health Ally is an important piece of training. We've had over 7,500 people at Accenture go through that. And as I mentioned, I had my leadership team as well. I just think that encourages more conversations and more opportunities for us to figure out what we need to do to support our employees.
Jimmy, that's such an important part of it. You said our leadership going through it because, I've had conversations with colleagues where it's like, everybody says it's okay to stay home, but yet my bosses are at work in terms of working from home. I mean, parents are role models. Your bosses are role models. What they say and do, say a lot more than maybe a policy.
Yes. I think that's a very good point. And this is one of the things when I'm talking with CEOs of our clients right now, they're really putting a lot of thought into. Many expect that even post-COVID, whatever we want to call that period of time, in the future, they're going to be in more of a hybrid model of some people working at home, some people working in offices, and some people going back and forth. And it is incredibly important that there is no stigma associated with the people that are productive working remotely. And it's one of the things I think you really have to think about. How do we look at performance and what are our policies there? Because frankly, you don't want to put all of that pressure on supervisors around kind of making some of those decisions to support. So I think that's a really important area that leaders have to lean in. You have to use your platforms to talk about mental health, to talk about it's okay if we're productive working from home to be working from home. Because I agree, everybody watches the leadership to see what they reward and what their consequences for.
You were talking about some of the programs, and you talked about the program that you did with Stanford and 160,000 employees, the Thriving Mind. You also have done Talkspace. You've got an app, a chat bot. Tell me a little bit more about some of the specific programs you guys have implemented to help people with their mental well-being at Accenture.
Great point, Carol. So first of all, I would say another silver lining I do see coming out of this crisis is the opportunity that technology has for helping address mental health issues. The two biggest challenges we tend to see with mental health, one is it's taboo to talk about and to go into a therapist's office to get help. And then the second is, for a lot of people, it's just access. So I may not be able either to afford or to have geographically to be able to go to a therapist. And so I think virtual mental health is going to explode coming out of this crisis. And two examples that we've implemented, one is Talkspace. So this is confidential virtual therapy. People are able to send unlimited text, video, audio messages to a therapist, with their web browser or with a mobile app. And the therapist can respond daily, 5 days a week. They can also do live sessions with them. And the other thing that we launched in February that I'm very excited about is an app called WISA, a very friendly penguin who is a mindfulness coach. And one of the things that we heard from our employees is some of the things that we're doing for them are great, but they want to be able to help others in their families as well. And so this WISA app, we have made that available not only to employees, but to dependents age 13 and older. And so this enables, again, 24/7, an app that can really help you develop coping mechanisms to be a little more resilient with some of the mental health challenges.
Hey, one thing I wanted to ask you, Jimmy, is that, listen, a great employer can put out a lot of programs for their employees, and yet they might not tap into them. You talked about kind of, you're a consulting firm. You've got, safe to say, I'm a type A. There's a lot of type A personalities. They're like, I've got this. I'm a workaholic. I don't need help. So you can put out these programs, but nobody taps into them. What did you need to do? Because my understanding is you maybe had to kind of nudge people to maybe get them going on some of these programs.
Well, yes. And I would say one of the biggest things I've seen coming out of that mental health ally training is knowing what these programs are so that you can talk to people about them to encourage them to use them. But I continue to think this is the biggest challenge that we have with mental health for all those type A personalities out there. If I'm really feeling physically ill and sick, I'm much more sensitive to not coming into work, or if I'm working remotely, unplugging from work. But if I feel very stressed out or I feel very depressed, if it's a mental health challenge, people don't seem to treat it the same way. And I think this concept of self-care is so important. Carol, one of the standard questions I get asked a lot is like, what's the best advice you've gotten in your career at Accenture? Mm-hmm. And what happened is I used to be someone that would go around and help problem solve where we had large programs that were struggling. And I would always bring in a team psychologist to kind of look at how the leadership was working together. And so I step into one of these, a very dysfunctional leadership team. I got this team psychologist to go in, do surveys, interview with people. She scheduled some time with me. And I said, great. I know it's bad. Tell me what I got to do to fix this. And she said, well, I'm here to interview you, not to talk about the team. And I'm like, me? I just got here. I'm not part of the problem. But she was relentless. And so we went through that process and I got the best advice of my career out of her, which is, like a lot of type A people, you've got these two little voices in your head. And one of them is never satisfied, always thinks you could have done a little bit better. You could have gotten up a little earlier. You didn't need to eat that dessert last night. And it's never happy. And you have another one, which is very kind to you, but you don't really listen to it very much. You listen to the one that's never satisfied. Tell the one that's never satisfied, go have a tea and start listening to the one that's very kind to you. And I completely related to what she said. I didn't listen to that kind voice very much. And I think one of the most important, foundations of self-care is you have to be kind to yourself. If you're not kind to yourself, it's very difficult to take care of others and try to be kind to others. And I would have never gotten that advice or began to work on that had I not gotten pushed pretty hard. So I always think it's important for us to really support and push our people to get the kind of help that they need.
But I'm going to go back to, I'm thinking people are listening and they're like, I get that, but I've got a boss who says, I need that now. I know you've got problems, but you know what I mean? Like, so it really is going to change kind of a mind reset when it comes to management and leadership, I think, right?
It is. And I think this is where companies need to do more training for their leaders and supervisors to make sure that they are understanding the impact of mental health on productivity, on their people, and being supportive of their people. And I mean, Carol, you're right. Not everybody gets it. And if you happen to be working for somebody that doesn't get it, that's hard. It really is hard. But the best thing I know, most companies will have confidential employee assistant programs or phone lines that you can talk. And I think it's important that, people continue to bring it up, make sure that our leadership knows about it. But again, like I said, the onus is going to be on the leadership of these companies to not only put the programs in place to support people, but to provide the training that leaders and supervisors need to make sure they're encouraging people to use those programs.
I've got a couple questions from the audience, and Jimmy, if I may, just bring them in. One is, I see many different approaches to employee well-being, which seem to be stamped on the minute things, or stamped out, the minute things get tough. How can we truly balance the well-being of our people and our employees with the tough decisions, redundancy, pay cuts that may be or are necessary to survive long-term? That balance, right? That's from Paul in England. What are your thoughts on that?
Well, this fair point. This is very top of mind for all the executives I talk to. And one of the things I have talked to them about is people vote with their feet. So if you're not going to respect them, if you're not going to take care of them, they're not going to work for you. And candidly, if you look at the last 12 months, most companies have seen a drop in their unmanaged attrition, in people deciding to leave, because of course it was a pretty scary time to leave. And it was also not as easy with everything being virtual to go through interview process and stuff like that. I think this sort of discontinuity for people in how they work and how they look at their companies has a lot more people really thinking about, where do I want to live? Is this the company I want to work for? And I think you're going to see attrition for a lot of companies increase over the course of 2021. Well, all these companies that say, I'm optimistic about hitting my growth goals for 2021, they're not going to do it if they're losing their best people, if they're losing their talent. So I agree with the question that sometimes it feels like short-term decisions don't support what are clearly important medium to long-term programs that people need to take care of their talent. But I will also say the work that we're doing with clients, I am seeing more emphasis now placed on how to take care of the employees, how to take care of the workforce. With the speed at which some of this technology is being rolled out around cloud and automation and artificial intelligence, I see a focus on companies wanting to get their employees more digitally fluent and how they can work in the future. So a lot of focus on new skilling and investments in people. We're doing a program with Best Buy right now where they want to hire more diverse employees to their workforce. They want to be able to upgrade that digital or technology knowledge. And so we've made available our catalog of internal training to be able to help them do that. And I see a lot of interest from companies in investing in their people that way.
Jimmy, one last question. And I know we've touched upon it a little bit, but if you had two pieces of advice, one for how to make sure that you are finding out truly how your employee base and your leadership team, for that matter, are feeling, what piece of advice would that be? And if there was somebody also out there who wants to take some advice back to their team about, okay, we've got to get some programs going, what would be the first step to take?
Well, the first thing I would say to those leaders is you have to ask your employees how they're feeling. You can do that via confidential surveys. You can do that in one-to-one discussions. You can do that by making it important to your direct reports. Ask them, how's their organization feeling? How are they doing? But I think the other thing that goes hand in hand with that for leaders is you have to be willing to be vulnerable yourself. I agree with some of the questions earlier. If your boss acts like this is not something that is important, that I feel, you're not going to be successful with this program. So I would encourage the leaders. My advice is be vulnerable. Don't be afraid to do that. Let people know when you're struggling. Let people know how you're supporting the people. For the question of if you don't really have a lot of these programs and you want to get more going, I think making sure that's visible to leadership and encouraging them to look at a lot of these technology-enabled solutions to support people. They can be very cost effective. So I think it's something that does not require a substantial investment on the part of the company, but can really pay big dividends for the people.
All right, we're going to leave it on that note. It does sound like the conversations around mental well-being are definitely changing in the corporate culture. Is that safe to say, Jimmy?
I think so. Long time coming. I think, it's, as you said at the start, Carol, there's been so much media coverage and discussion around the health crisis, the economic crisis, and the social crisis. I'm really happy to see now we're talking also more about this mental health crisis. I think that can lead to change.
Me too. Jimmy, thank you so much. Really appreciate your time. And I know our audience does too. Jimmy Etheridge, he's the CEO of Accenture North America. Thank you so much.
Thanks, Carol.
Coming up next, Bloomberg New healthcare reporter Emma Court continues the conversation with a great panel on looking after our colleagues.
Hi, everyone. Thank you so much for being here with us today. I'm Emma Court, a healthcare reporter with Bloomberg News. Today we'll be talking about looking after our colleagues as COVID-19 prompts a global work from home experiment and presents challenges for employees from lack of social interaction to blurred boundaries of work and life and lack of childcare and parenthood. Here with me are our great panelists, Dr. Ashwindi Zanuz, Chief Medical Officer of Salesforce, and Lena Nair, Chief Human Resources Officer of Unilever. Thanks so much for being here with us. So let's set the stage for this. Oh, lovely to have you. Let's set the stage for this conversation a little bit. When COVID was first sort of sparking lockdowns around the world last year, how quickly did you see that start playing out for your employee population? I thought perhaps Lena could start. I imagine with such a global force at Unilever, perhaps you first started thinking about this in Asian countries, or has the focus really been more in countries like the US, where the outbreak has been so prolonged and so out of control for such a long time?
Great question. I mean, it's a year now. Can you believe that? When our lives changed. You know, we have 150,000 employees in 190 countries. And what happened was overnight on March 17th, all 66,000 office-based employees started working out of home across all countries. And the remaining 90,000 people who are in manufacturing and sales continued going to work, albeit with a huge number of safety protocols to ensure their health and well-being. So one of the big learnings I had from COVID is that one size doesn't fit all. Every country responded differently. Every government went through a different stage of denial, different stage of recovery, different process on rehabilitation. So it was as if one size didn't fit all. Now, what struck me was the range of things we had to do. I often say that this was the most stretching time in my career and in many ways the most fulfilling. Because in many places we were leaning into medical infrastructure, like buying tests in some of the 17 of the countries we operated in, converting warehouses into ICU beds. In some places, it was about ensuring our people had all the equipment they needed to be able to work out of home. In others, it was providing support for homeschooling, for people who were caring for vulnerable people. It was about setting up testing facilities in our factory sites. So it was a huge range of issues that we had to deal with that encompassed medical infrastructure, health and well-being for those who are going to work, support for those who are working out of home, well-being challenges, both mental and physical, for all our employees. So it's been an incredibly stretched time. I think one where I still feel very positive because we've seen the adaptability of the human spirit through all of this. And I think if there's one line that stays in my mind, it is we are all in the same storm, but we are not in the same boat. We've all been in different boats, and companies like ours have had to respond to different needs, different challenges, people challenged with different circumstances.
Absolutely. Dr. Ash, is there anything you wanted to add to that about the Salesforce experience? I know that Salesforce is also involved in some of the vaccine kind of distribution as well.
Thanks so much for having me on, first of all, Emma. I can't echo Lena's comments more. I would say that this has been an incredible time over the past year. I know for me, I started this job about 2.5 years ago, came in here thinking about solutions and strategy for our healthcare and life sciences customers, but quickly last year I had to take a hard right to also start thinking about our own employees and broader customers across, all different industries. I know for us at Salesforce, we too very early on recognized that this was more than just another virus, that this could potentially be an epidemic, if not a pandemic. Many of us inside the company come from a global health and public health background. And when we started seeing some of the changes around different parts of the world, we quickly recognized that we had to change how we were thinking about our own employees and how we work with our customers. So, I would say in March of last year, we are a company of about 60,000 people now. We also all went remote everywhere around the world. And I think, most of us are knowledge-based workers. We're used to working remote, you would think, but it is a very different experience to work remote every once in a while, or, part of your workforce being remote, to completely going remote from everything from day-to-day interactions, working with your colleagues, hiring new people, onboarding new people, working with your customers, ensuring that there's success on implementation for the customers, working with data and security, so you still have to have some people coming into the workplace. So I think, we were thinking about the similar challenges to what our customers were going through, but also trying to implement some of those challenges and changes, address some of those challenges and implement changes internally, for our own employees. So, happy to talk about all of this, but I think all of us have had through, growing pains over the past year. But I do think that, what we've recognized coming out of all of this is the future of work is going to look very, very different on the other end of this. And those of us that have adopted and thought about and constantly thought about what that looks like will probably fare better.
That's a really interesting point. I wanted to be sure and ask both of you, since we are talking about mental health here, and these have been big adjustments for everyone. How are you two doing during this pandemic? How has this adjustment fared for you? How have you found this time in terms of balancing work and life when there are so many new work strains and fewer kind of clear, you commute home and the workday is over, boundaries?
I'm an extrovert by nature. So my standard operating procedure was to walk everywhere. I'm a big hugger. I like to talk to people, have a cup of coffee with them, hug them. So it was really, really hard to not have contact with people. It was, so some days were really, really challenging because I would miss human company. I chose human resources because I like being around human beings. I love just being around people, hearing human voices. So that was hard. But I missed my parents. I haven't seen them now for a year and a half. It's impossible to travel into India. I'm based in London. So that's been hard, not being able to see loved family members. But in many ways, there's also been some strengths. I mean, my husband and I have never been in the same city for so long together. We both have jobs that have a huge amount of traveling in them. So it's been great. I had both my teenage sons at home, locked in with us. A wonderful experience for us. I'm sure a claustrophobic experience for them. It was great having, the family together. So there were some joyous moments and some silver lining to the dark clouds. I must say, I have learned to meditate. I would never have believed that if you told me a couple of years ago that I would take meditation seriously. But I've learned to meditate, long walks, a bit of prayer, a bit of reflection, writing in a gratitude journal. So I've had to make some little practices to improve my own resilience. I always say that if you don't put your own oxygen mask or you don't put it on yourself, you can't look after anybody else. You can't help anybody else with their oxygen mask. So as leaders, we have to lead from the front on self-care, on building our own inner game and our resilience. We have to lead from the front on mental well-being.
Yeah, I couldn't agree more, Lena. I would say, I think this has been mostly a positive experience in terms of being able to spend more time from home. Like Lena said, I too have had a lot more time with my spouse and my young kids. But on the flip side, I'm also homeschooling two young children. It was an adjustment in the beginning, trying to get them to get into the flow. I think a lot of young people, especially school-age children, require that social interaction. So it was really hard for my teen to reconcile the fact that she just had me and her sibling and my husband to interact with. So I think some of these challenges were challenges in the beginning. But on the flip side, I think I've really adjusted to this remote work. I've learned to connect with my customers, and I can connect with a lot more of them now with remote, right? I don't have to spend an entire day on a plane to go see somebody. I've learned to get on a Zoom call with 10 people and interact with them in one setting. So I think there are some like positive things out of all of this. As a company, we do a lot of well-being surveys that started very early on in the pandemic specific to this. And as we started recognizing that our employees, were faring a little bit worse than normal when it comes to anxiety and mental health strain, we as a company started thinking about, how do you engage all of the workforce, right? So we had this thing called Be Well series where we brought conversations around mental, behavioral health, meditation, to Lena's point, self-care to the broader workforce, and had open conversations. And I took this back to my own team, right? So I think part of, for me, was being transparent and showing my own team that it's okay to feel not completely normal about all of this, because it's not normal times. And to take time to have well-being days, which our team takes, to just shut down. I think all of these things were changes that I had to make. And I think for me, I'm also a physician, so I often go out to the facility where I volunteer. And I was seeing a lot of my friends and former colleagues on the front lines. And you see a totally different experience for people who've been on the front lines, right? Your nurses, your doctors, your emergency medical technicians, your food service people, the people in the grocery stores, the manufacturing plants. They have a totally different experience this past year. So I had to kind of reconcile how I was dealing with it versus how my friends were kind of taking this on and dealing with it, and how they were taking care of their families during this time. And I was able to bring some of those experiences back into my own workforce when I talked about things, to say, here are things that we need to be thinking about for our employees. We too have people coming back in to deal with the servers and to deal with data security components, right? These are like in-person jobs for a lot of times. So I think for me, I would say, like I said, I think overall, I would never say that COVID is a positive thing, right? But I would say that I've learned a lot out of this experience about myself and different ways of working, where it used to be just like a go, go, go mentality for me. Now I'm a lot more thoughtful about the things that I do. I've learned work-life balance. I've learned to say no. I've learned to shut off and take time for my family. So working from home has been a lot more enjoyable, rather than just sort of bleeding into like the entire day where there's no on and off switch. Yeah. And I've heard my own CEO say this, where the 9-to-5 workday is dead. And I think that's so true for me, because I've now like shut down during the day where I just need to go for a walk. I've invested in a Peloton, which I've resisted for, I don't know, a very long time. I've said, this is really important for me to be able to do this, and just take time out of my day to care for my own health and my well-being. I think these are all things I think that translate down into your teams, into your workforce, into the customers that you work with. So I've come out of this, I think, much stronger.
That's really interesting, and such a good point about, being able to take that time and feeling like you're allowed to take that time, and setting an example at the top. I'm hoping, Dr. Ash, you could talk more about the internal surveying you've done at Salesforce. I know one survey that you put out mid last year found that 36% of employees are reporting issues during the pandemic. That almost seems a little bit low to me. So I'm hoping you could speak about what your surveying has found over time, and also a little bit about what you think those findings mean, and what you look away from.
It could be my connection, but you're breaking up a little bit, Emma. But so I heard you say surveys. So, we do survey our employees monthly. And so there's a lot of data that fluctuates, obviously, over the course of this past year. And we noticed early on that our employees were hurting. And again, like I said, this fluctuates a lot. But at some point during the surveys, you're right, we had nearly 2/3 of our employees were reporting that their mental health and psychological well-being was worse than usual. And I think this is something that we took and continue to take really, really seriously. And out of that has come a lot of different things that we brought out to the employees to navigate this all of a sudden complete remote work environment, right? So, it helps us sort of understand where they're having pain points or what kind of anxieties that they're having that we can attack, right? So some of the things that we found were around being in an enclosed space with a lot of family members, especially in bigger cities where you had a spouse that was working and two kids working all at the same time in a small space. So we had to sort of think about, yes, we're in a pandemic, but how do we allow for some space outside of the home that's safe, right? What are the types of tools that we can bring in, like tracing and testing to our employees so that they can be out of the home in a way that's safe for their own well-being. We also recognize that there are times that, we need to allow people to just shut down. And this is where, like I said earlier, the 9-to-5 workday is dead kind of came out, where people said, we need time for our families. We need time to homeschool our kids. We need sometimes to just be off. It's not just kids, right? We have aging parents or sick parents out of all of this. So for us, we had a lot of learnings. We had learnings about, how do you change your workday? How do you become more flexible? How do you allow for flexibility for your employees? We also gave out an extended family leave for people that needed it, where they just couldn't focus and had to be off. We said, just take 6 weeks off. And it no longer is just for your children, take it off for your parents or, caring for the people around you that are part of your family when that's needed. We gave out wellness, reimbursement to ensure that your workspace was a safe place for you to work. And if that meant getting ergonomic equipment or the right type of tools for you to collaborate with team members. And when we saw that the pandemic was extending, we gave out another reimbursement package for people so that they can go and invest for a longer term, right? We saw that this was going to be a long haul where we weren't all going to just be returning back. And then over time, I would say, our employees started getting adjusted like I did to remote work and found that they were a lot more productive in many ways. And they started giving us feedback on potentially not returning full time to work. So we've looked at our policies around, who gets to work remote full time, who are some employees that we can accommodate to have, potentially a hybrid model where they come in part-time and don't come in and work from home part-time, right? So these are all things that the surveys have helped us understand and helped us guide how we look at our policy. Overall, I would say, compared to June, where we had 59% of the people on the employee scores were talking about not feeling resilient. Now we have 72% of our workforce noting that they feel more resilient. 51% today say that they feel more balance of work and home, whereas, in June, again, it was 33%. We've also had a lot more employees. We have 80% of our workforce saying that they feel more productive today than they did, earlier in the pandemic. So I would say, overall, I feel that we've made a commitment and we're working with our employees as we're developing these policies on what this future looks like for us coming out of this at Salesforce.
That's really interesting. We actually recently had a story about a new Microsoft global survey, which found that employees are overworked and exhausted, while business leaders actually report that they're thriving. And I was hoping, you two might be able to speak to the disconnect there. And, how can leadership do a better job connecting with employees and understanding they're maybe dealing with a different circumstance?
This normal we're seeing, what we're calling the new normal, needs a lot of reskilling from both leaders and others. Let me give you an example. When we go back, we are going to have a digital workplace where people continue working like this, where it makes sense. We're going to have a physical workspace because offices are going to open and people are going to turn up in offices to connect, to collaborate, to do something creative together. And we're going to have a kind of hybrid workplace where some people will be digitally on, some people will be physically on in a workplace in the same team. That means leaders have to have tremendous skills to be able to work in all three ways, whether it's a digitally connected one or a physically connected one or a hybrid one. And I don't think leaders today have the skills to do that effortlessly. I mean, today, if you have a meeting where half are digital, half are physical, most often the people who are online are forgotten about. The people in the room have a discussion and may turn towards the end saying, hey, all of you guys online, do you have something to say? So it really means equipping leaders and managers to learn about inclusion in a world that's hybrid, digital or physical. The other thing is life is hard, even when you go back to work. Let me give you an example. 90,000 of our people go to factories every day to manufacture soap and sanitizers and all the beautiful products this world needs fighting a pandemic. So they're essential frontline workers creating products for the world. And while we were worrying that our office-based employees are all going to feel lonely because they're all sitting at home, they can't get into work, they can't meet friends, what we discovered is our manufacturing people were equally isolated and lonely because they would turn up for work with a mask, have thermal screening, have testing at the factory gates, go in the factory, be alone in the changing rooms, be socially distanced, do their work, eat by themselves, because all areas where there's social bantering, like the coffee break area, the water cooler area, is all gone. In COVID times, it's all social distancing. So suddenly work, while they turn up for work every day and they're grateful to be able to do that and create some of these beautiful products, the sense of loneliness and isolation is immense. Because what they look forward to at the workplace, which is hanging around with their friends and colleagues and having a banter, all of that is gone. So the work experience has changed. So it's really important that we work with leaders to build a sense of empathy and sensitivity in our leaders. It's not okay to assume that it's the same for everyone, that their lives are thriving because they have autonomy and control over their times and how they work. But that's not true of everyone down the line. People have varied pressures. If you're homeschooling kids, like Dr. Ash was telling us, of course, it's a whole new level of complexity. If you have parents to care for, it's a whole new level of complexity. So it's important that our leaders are trained in a bit of empathy, inclusion, sensitivity, to walk in other people's shoes and to make flexibility work for everyone. Because there's no work, if your workforce is not feeling engaged, then you don't have a healthy workplace. There's no question about it. So leaders have to work harder to create a flexible and productive workplace, one in which they thrive and every single employee thrives. You know, one of the things I was happy about was in Unilever, right through COVID, our engagement scores went through the roof. Our pride scores have gone through the roof. People feel this company supports them on well-being. They feel 86% of them feel their leaders support them. That's the kind of scores we want across the world. Then leaders must take equal pride, not just in their thriving, but in the thriving of their workforce. That's what they're here for real leadership.
If I could just comment, I'll say I couldn't agree more. I was just going to say, you know, leadership in times like these matter at every level, whether it's at an organization or a government. You know, I think you have to lead by influence and you have to have an engaged workforce. You have to have an engaged system, right? So when the country feels happy because you have leadership at the top showing that, you know, we're going towards improvement, everybody feels better. I think what we've learned from some of the prior traumatic events, which I considered this one to be, like post 9/11, we saw that there was long-lasting impacts. There are people from, post 9/11 in New York that have shown symptoms of PTSD going into 14 years after the fact. So I think we all have to be cognizant that there are a lot of people suffering. Their mental health impacts aren't just going to go away when the pandemic ends. You know, there's probably longer term consequences to this. And so as we're thinking about our workforce, our communities that they're in, the people that we interact with, I mean, for us, definitely our customers, right? I think we all have to be cognizant of the mental health impact of what is going to last after this pandemic. and ensure that everything that we're thinking about, from our own employees and benefits to our interactions and enabling the workforce and the tools, are going to be equally available to everybody, both our knowledge-based workers and people on the ground, and the way we interact with our general community.
Those are really, really great points. And I think we're all thinking about how the pandemic will reshape the way we work, the way we live, and the way that we support one another. And I think hopefully everyone is considering mental health as part of that equation, no matter what aspect they're thinking about. Well, thank you so much, Dr. Ash. Thank you so much, Lena, for joining us here today. We so appreciate your perspective and contributions, and hopefully all of our audience members will keep this conversation going in their own workplaces.
Thank you for having us.
Thank you. Thank you.
Our thanks to Bloomberg's Emma Court and her panel for such a relevant and meaningful conversation. All right, now let's get to Bloomberg Live's Senior Programming Director, Yajou Sun, who caught up with a leading clinical psychologist on COVID-19's mental health impact. Here's their conversation.
While countries around the world are still fighting the spread of COVID-19, psychologists are warning that we can't lose sight of an equally alarming issue, and that is the long-term mental health impact the pandemic is going to leave on our society. And with me today to discuss all of this is Professor Richard Bentel from the University of Sheffield. Professor Bentel, you and a team of leading experts conducted the most comprehensive study of COVID-19's impact on mental health in the UK. What are the key findings from the research?
Okay, so what we did was that we surveyed a sample of about 2,000 British citizens starting in the last week of, starting on the week of March 23rd last year. And we've been following them up ever since to monitor their mental health. And we've obviously had to do this online, but we think they're a highly representative sample. We used a survey company to help us recruit them. So they're representative of the UK in terms of age, sex, and also household income, and also a whole range of other factors which we checked post hoc. What we saw, broadly speaking, is that in the very early days of the pandemic, in the first lockdown, we saw an increase in depression and anxiety, we think, in the first kind of few weeks. But contrary to what a lot of people were fearing, that didn't really escalate. And what happened was that mental health kind of came back to the kind of level you would expect by the end of the summer. But one thing which is really important to say is that those figures kind of mask a highly heterogeneous response, and that different people responded in different ways. So the pandemic is by no means a kind of universal mental health catastrophe. On the other hand, what we see is that there are some groups who have suffered, and there are actually some groups who've done very well. They've actually benefited from the pandemic.
Speaking of groups who have suffered, the frontline healthcare workers around the world are probably the most vulnerable group. Do you think they will suffer from prolonged mental health problems?
Well, some of them probably will do. Our survey wasn't actually designed to pick up frontline workers, although actually we did do an analysis of frontline workers because out of our entire sample, about something like 400, I think it was, were in occupations which you could define broadly as frontline. And we defined this quite broadly to include things like supermarket workers, for example, because they are facing strangers every day of the week, face to face. What we found is that it was certainly true in our survey that frontline workers were doing worse than the general public. And in fact, supermarket workers in particular seem to be doing quite badly in the first lockdown. I think they're a kind of neglected group. We've simultaneously been collecting data from hospital in Sheffield. We haven't really analysed that in great detail yet. It takes a huge amount of effort to analyse this stuff. But certainly we see quite high levels of mental health complaints, I suppose I could put it, in those people. One of the things I should say about that, which we found was kind of looks a bit paradoxical, actually, those who are working most with COVID patients seem to be least affected. But we can explain this in terms of course, those are the people who are most prepared, probably the best informed. And also there's this sort of thing which is well known to psychologists, which is if you're exposed to a threatening stimulus over a period of time, you adapt to it. That said, we know from previous research that if you look long term, it's very likely that some key workers will actually suffer mental health difficulties persisting beyond the pandemic.
Teenagers around the world are spending their formative years in isolation. I wonder if this will lead to a less sociable generation, and are we going to see more serious damage such as PTSD and substance abuse?
So we don't really know what the effect will be on teenagers. What we do know is that younger people have been much more affected than older people. Younger people are generally more sensitive to depression and anxiety than older people, so that's not surprising. And I guess, we will find out in due course. One of my colleagues has collected a large sample of teenagers and is looking at data now. But they've suffered quite badly from having their social relationships kind of severed, and also from, of course, losing schooling. So I'm not sure if I'd expect that to lead to PTSD type symptoms, but I can see that it might well lead to anxiety symptoms in general, and that teenagers will have some difficulty in readjusting once the lockdowns are over. In terms of PTSD, the group which are most likely to suffer are people who've been hospitalized and sent into ICU. We know again from previous research that ICU patients have a very high rate of PTSD, and it's not surprising when you consider their experiences. I mean, PTSD is a reaction to a near-death experience, basically, in most cases. So if you're taken into ICU, you've got a good chance of dying. And it's worse than that, because you might be intubated, you might find it difficult to communicate with people, and the people you're trying to communicate with are people who are masked up. You'd probably, people who die of COVID in hospital die not seeing a full human face. So that's an awful experience, and we will expect, I don't know what the number will be, but it wouldn't surprise me if it was above 50% of those patients would develop PTSD symptoms. And they need to be provided with the appropriate treatments for PTSD. And there are some effective treatments for PTSD.
The pandemic has impacted women disproportionately. In the US, nearly 3 million women have dropped out of the workforce since last year. And we're seeing this trend globally. Surely this has an impact on women's mental health, right?
Well, you'd expect it to. I think women are doubly disadvantaged, actually. It's not just that they drop out of the workforce. It's also that they tend to take the burden of childcare. And of course, a lot of kids have spent time at home. How that pans out will depend a lot upon pre-existing family relationships. So, for example, in our survey, we did ask people in July, I think it was, about their family relationships. And we haven't published this yet, but we have had a look at the data. It's clear that actually the majority of people have actually enjoyed having older children at home. But it's equally clear that having young children at home has been extraordinarily stressful for a lot of people. So in terms of, if you want to identify groups which have been particularly badly affected by the pandemic, women with small children at home seem to be, they're an important group. It's also worth saying that in our own analysis, we find that economic factors seem to be quite important. It's important to realize that pandemic is not just a kind of one thing. It's a multifaceted phenomenon. So on the one hand, there's fear of illness. Another, there's kind of social isolation. Another, there is the loss of employment, disruption of daily routines. and loss of income. And in our data, it seems to be that the loss of income seems to be an important driver of anxiety in particular.
This actually leads to my next question. Obviously, aside from lockdowns and social distancing, poverty and unemployment are equally, if not more, emotionally devastating. So how would you advise governments around the world to address the economic threats to people's emotional well-being?
Well, it's probably important to say that I'm not an economist, but it seems to me one of the things I'm interested in is the idea of mental health interventions, which are not mental health interventions. We can treat PTSD after it's happened. There are some psychological interventions which are known to be highly effective and they can be delivered. But wouldn't it be better to stop people developing psychological disorders in the first place? And that's the task of government. So if you want to protect the population against mental ill health in these very difficult times, an obvious thing to do is to make sure that people don't lose income. At the moment, what's happening is we've got this some people who are losing income and mounting debts, and that's linked to high levels of anxiety. On the other hand, we've got professional people like me who've had their commute cut to zero and who are able to continue working, and we're saving because we've got nothing to spend our money on. So we've got winners and losers, and that's probably magnifying the level of inequality in our society. We know anyway that inequality is linked to mental ill health, that more unequal societies are societies which have higher rates of depression, anxiety, pretty much every type of psychiatric disorder you care to name. So it seems to me that government needs to protect those people who are poorer people in particular, and people who are losing income. Also, there are other things which government can do. I would have thought that they ought to particularly think about the group I mentioned earlier, which is young women with children at home. What can you do to provide support to those people in the home environment? I think education, the way that education is delivered might be a significant factor there. Schools in Britain were, I'd have thought, not fast off the mark in the early stages of the pandemic. It's easy for me to say sitting in my office in Liverpool, but had I been a government advisor at the time, the thought did occur to me. It seemed to me, a mass effort to deliver education online would have been a good idea. I think I'd have created some kind of group to create something like our Open University, but for school kids. That's now happening. My kids at home are now getting online education several hours a day, but it could have happened much earlier in the pandemic.
Richard, we talked about the government initiatives, and I want to pivot the conversation now to the private sector. The pandemic is probably the most uncertain time that a lot of us have ever lived through, and it's especially difficult for people with pre-existing mental illness. What can corporations and the private sector do to help their employees during these times?
Well, again, that's not an area of my expertise, but actually there are some clearly obvious things they can do. First of all, it's worth saying that corporations, businesses, have a big effect on mental health anyway. How jobs are structured and management policies have a big effect on the mental health of employees. So we know that employees thrive best in jobs in which they have where the demands are reasonable, where they have some control over what they do. So people in high demand jobs with very little control are people who tend to develop mental health difficulties. So employers obviously need to be very reasonable about what the demands they are putting on their staff, and also need to constantly take feedback from the staff and be listening to the staff and figuring out how staff can be supported to do the jobs which they're assigned to do. If they do that, my guess is that they'll find that their workers are more productive. The converse to that is that occasionally you come across institutions, and it's both in the public and private sector, and I can think of some examples in higher education actually, where management sort of seems to think that if they thrash the workers harder, they'll work harder. So, you have a kind of bullying and threatening management style. That's disastrous. That will just compound any mental health difficulties which staff are having. So, I think there's a lot that businesses can do to support the mental health of their staff, but having, an appropriate listening management style and an appropriate way of dealing with problems as they arise, ways which are not, at least in the first instance, punitive. That seems to be important. And allowing workers to have some say in how they work in these circumstances.
Mm-hmm. Large parts of the world have been under lockdown for over a year now. I'm speaking to you from London, and the city is currently under its third lockdown since last year. Even though some places around the world have lifted restrictions, we're not really socializing the way we used to. Do you think the pandemic will leave a collective trauma on our society, and would it take years maybe for our society to recover?
So I think, in some ways, I hope that when we come out of the pandemic, we won't go back to how things were before. The pandemic is an opportunity as well as a disaster. We need to rethink the way we live our lives. For example, my commute used to be 2 hours. It's now 15 seconds. I've been more productive, not less productive, since this all started. So I think that there will be some things which we've learned from the lockdown, which, if we're wise, we can capitalise on. I don't think there'll be what might be called, you've described it as collective trauma, or at least I think there's some reasons for hoping that that won't be the case. And the reason for this is that collective threats are less psychologically damaging than individualized threats. So we know, again, from previous research, that if you're mugged or sexually assaulted, the effect on your mental health is much greater than if, say, you're caught in a natural catastrophe. Why is this? Well, it's simple. Human beings are basically social animals, and we like to belong in groups. If we have a sense of belonging, then that's hugely protective against mental ill health. And some of the research which I did before the pandemic, we showed, for example, that people who felt that they belonged to their neighborhood were much more likely to be resilient to financial stress being something which you can measure fairly objectively. That being the case, what happens when there's a natural catastrophe of this sort? Well, what should happen, and this is something which government should encourage, and I don't think they've done enough to encourage. What does happen and should happen is that people come together and they support each other. Now in Britain, that's happened sort of haphazardly. My neighbourhood developed a WhatsApp group, and we got to know people up the road who we didn't know before, and we offered to do little favours to each other. If somebody's in the supermarket, they'll send out a message and say, I'm in the supermarket, does anybody want anything? That sort of thing. And that's hugely protective. So one thing which I think a lesson for the future will be, in the next pandemic, because there may well be one, what we need to be prepared to do is to foster that sense of community support in advance. And that might be just not so much to do with throwing resources at communities, but just simply messaging, just telling people that is something which will help them.
Mm-hmm. Mm-hmm. There's a stigma in some societies that mental illness, mental weakness. How can we break that stigma?
I think the stigma is actually reducing. I think it's to do with the way you think about mental health, actually. So for many years, the medical profession in particular has been trying to put forward a model of mental health, which likens it to physical illness. And actually, they did it for mostly benign reasons. They did it because they thought that the story that having a mental illness is like any other illness, that schizophrenia is like cancer, but just the psychiatric version of it. they thought that that would destigmatize people, but actually we know from research that it has exactly the opposite effect. What destigmatizes mental health is putting it in context. What destigmatizes mental health is understanding that it's to do with the world we live in and the circumstances in which we're trying to exist as human beings. So, for example, we know that drivers of mental ill health are poverty, inequality, personal trauma, problems in the way that kids are brought up, bullying in the workplace, and so on. None of this is rocket science, incidentally. Or anybody who's wise with a certain amount of common sense will know it. I suppose the difference is that over the last 10 years in particular, psychologists and epidemiologists and psychiatrists have collected a lot of information which confirms that this is the case. Without a shadow of a doubt, most of the determinants of mental health are not in genes or our brain biochemistry. They're to do with the circumstances in which we live. And if you want to make a mentally healthy world, you need to change the world, basically. But this is an idea which does destigmatize mental illness. And the reason why it destigmatizes mental illness is because it shows that the difference between those who have mental health problems and those of us who don't is wafer thin. That people with mental illness are no different, really, than anybody else. So, those of us who are, well, for a start, nearly all of us at some times actually experience some degree of mental illness. And, I know I've had mental health difficulties at various different points in my life during stressful times. I can think of times where, things were going really badly wrong in work or relationships where, I've been quite profoundly depressed or anxious. But that's a reaction to circumstances. And if we all recognize that we're capable of having that reaction, then we realize that the world isn't divided into two people, the mentally ill and the mentally well.
Thanks for that, Professor Bentel. I hope our society can become more resilient and more equal after the pandemic. Thank you very much for your insights today.
Thank you all for joining our discussion on mental health and the economy. We hope you found these conversations informative and instructive. Thanks again, too, to all of our speakers for their smart and thoughtful contributions. And thank you, too, to our sponsor, Cigna, for making this virtual summit possible. Please visit our resource center to find out more about health and wellness. And most of all, thank you, everyone, for being here and for being such an engaged audience. Now, to rewatch any part of this event, you can come back to this website where the recordings will be uploaded. You can also access videos of all interviews on Bloomberg Live's page on YouTube. Take care, everyone. Stay safe. And thanks again for watching.